We use every cutting-edge technology available.
Preventing strokes, disability and premature death from an early age. Who can receive treatment at this national hospital? And what does it really take to maintain good health? These surgeries are extremely costly. Nearly 99% are covered through competitive tenders and health insurance. Living to 100. How Kazakhstan's youth can become long livers, and the secret behind the vitality of our grandparents.
Not everyone at 78 can do what she does. Here's our veteran, Tamara Maximova. She's about to turn 101 and still serves on the hospital's board of trustees.
This medical institution has nearly a century of history, evolving from a private clinic into one of the country's leading national hospitals. Established in 1929, it was created when the capital of the Kazakh SSR moved from Kızılorda to Almaty. The new capital needed a center to attract top professors and medical experts. But this wasn't just a clinic, it also functioned as a sanatorium. Its patients included high-ranking officials, prominent scientists and cultural figures.
Since the early 1990s, our hospital has been open to everyone. Healthcare became accessible to all citizens of the Republic. With the introduction of funding reforms and health insurance, any patient now can be admitted through our online portal. Blood pressure looks perfect, 120/80. Once your results are ready, we'll meet after lunch and go over everything. Did you tolerate the infusion system well? Yes, it was fine yesterday. It supports the vascular and cardiac systems. We'll make any adjustments once we have the full results. Sound good? Sounds good.
Today, the National Hospital stands among the country's leading clinics. It's home to specialized centers in arrhythmia, nephrology, neurosurgery, physical therapy, endoscopy, hemocorrection, oncologic surgery, gynecology, dentistry, anesthesiology, and intensive care. Diagnostic services include radiology, lab testing, and functional diagnostics. The system automatically sets the focus and mode. The technician just presses a button. The machine does the rest. We can perform tomosynthesis here. I haven't seen equipment like this anywhere else in Almaty. It scans the lungs or abdominal organs layer by layer, millimeter by millimeter. In many cases, it can replace a CT scan with much lower radiation. A traditional CT scan exposes the entire body to radiation. Tomosynthesis, on the other hand, targets just the area of concern, delivering sharper, more detailed images with far less exposure. This is a 1.5 Tesla MRI scanner. It's capable of performing the full spectrum of MRI diagnostics, from brain imaging to joint assessments. A brain scan on a 1.5 Tesla MRI takes around 20 minutes. With a 3 Tesla machine, just 12. That means more patients can be seen more efficiently. But even the most advanced technology is only as good as the people behind it. That's why this hospital invests heavily in training young doctors, advancing medical knowledge, and bringing in top-tier specialists.
Статус национальный, конечно, он дает нам очень много преимуществ. Это
Having national status gives us real advantages. It means extra funding, access to health ministry programs, and access to development initiatives alongside the country's top research institutes. It also opens the doors to taking part in international studies.
Участвовать в программах развития медицины. Это дает нам возможность участия в международных исследованиях.
Neurosurgeons here perform the full spectrum of brain and spinal procedures. The department has 25 beds and treats patients with brain tumors, herniated discs, vascular disorders, and other complex neurological conditions.
Когда открылось отделение, это в 2016 году,
Our department opened in 2016 with a team of highly trained specialists. Since then, we've performed more than 1,000 surgeries each year,
это
from endovascular procedures to complex operations on the brain and spinal cord.
на головной мозг, на спинной мозг, на опухоли, на патологии сосудов головного мозга. И ежегодно, да.
Including tumor removal and treatment of vascular conditions. Every procedure is done to international standards, using the latest medical technologies.
Придерживаться всех новейших технологий. Допустим,
Take minimally invasive surgery. 10 years ago, a craniotomy required a 10-centimeter incision. Today we can do the same procedure through an opening just 1 centimeter wide.
где-то 10 сантиметров трепанация. Сейчас это все сокращается до 1 сантиметра. И есть хирургия.
For lumbar disc herniations, we used to make large incisions. Now, we remove even major hernias through a tiny puncture, just 8 millimeters.
То есть до 0,8 сантиметров. И таким образом мы можем удалить огромную грыжу.
But perhaps the most important work here focuses on prevention, because one of the biggest global health challenges today is cardiovascular disease.
К ним относится инсульт, который является одной из
One of the key conditions we treat is stroke, a leading cause of death and disability worldwide.
инвалидности. И мы, закрывая аневризму,
By treating aneurysms, we prevent strokes before they occur. Every year we handle about 250 aneurysm cases. Most of these procedures are highly advanced and costly. Almost all, around 99%, are covered through competitive tenders and insurance programs.
очень дорогие операции, 99%, можно сказать, проходят по тендеру. Да, по страховой медицине.
After surgery, patients undergo rehabilitation here. The physiotherapy department offers hydrocolon therapy, shockwave therapy, and a full range of therapeutic massages.
Как система мини-здравоохранения у нас есть своя поликлиника, свой стационар, свои диагностические подразделения, лаборатория, которая была.
We function as a mini healthcare system with our own outpatient clinic, inpatient unit, diagnostic departments, and a fully equipped lab. This allows us to provide seamless, continuous care. We monitor patients on our outpatient basis, and if their condition worsens, they're admitted for treatment. After recovery, they return to the clinic for ongoing therapy and rehabilitation. Our patients never fall through the cracks. They're under constant medical supervision.
Из поля зрения не выбывают, то есть постоянно под наблюдением врачей. Это позволило нам...
This approach has delivered real results. Our patients' average life expectancy exceeds the national average. That's thanks to regular checkups, preventive care, and timely hospital admissions whenever urgent treatment is needed.
Осмотров и своевременной госпитализации, когда требуется помощь неотложная.
It's no surprise that the clinic's signature feature is its Center for Gerontology, focused on helping Kazakhstani citizens live longer, healthier lives. According to the National Statistics Bureau, the highest life expectancy at birth in Kazakhstan is in Almaty and Astana, nearly 79 years. Here at the clinic, some of our pensioners were born long before the first brick was laid for the building.
175% у нас долгожителей, то есть 90 лет и старше. А 7% на сегодня...
We have 175 patients aged 90 and above. 7 of them have already celebrated their 100th birthday. Our oldest patient is 104. Akhanum Bobe Akjolova. They're all active, sharp-minded, and independent, full of energy and life. Our main mission is to help them enjoy a long, high-quality life, not just to survive, but to truly live and enjoy every moment. The more time I spend with them, the more I learn. Don't stress, avoid negativity, stay positive, and don't focus on the bad.
Что-то для себя тоже отмечаю. Советы, которые они дают, то, что нельзя стрессовать, нельзя негативить, но нужно быть всегда на позитиве, не думать о плохом.
A healthy old age won't come if you have burned the candle at both ends when you were young. That's why a lot of focus here is on working with young people.
WHO experts have shown that just a few factors could prevent most chronic non-communicable diseases: smoking, lack of physical activity, irregular daily routines, and poor diet. These might sound simple, but changing these habits takes real effort.
Но вот именно их нормализовать, привести в порядок, это значит переломить себя, переломить свои...
Some people stay up until 2 or 3 a.m., then have to rush to work early next day. And then there are certain eating habits. For example, many young people consume a lot of sugary and energy drinks, which aren't exactly good for you.
Энергетики, это же мало пользы приносит.
Врачи максимально стараются помочь.
Doctors do everything they can to help. But if a patient isn't willing to help themselves, it's all in vain. Without a positive attitude and commitment to recovery, there's little chance of success.
На позитив, на хороший исход.
That's why here they don't just talk. They demonstrate the real risks and consequences of harmful habits.
Достаю калькуляторы, учу их самостоятельно.
I teach them how to use calculators to work out these health indexes themselves. For example, a smoker might say, "I only smoke about 10 cigarettes a day. That's not much." He's been smoking for 15 years, but when we calculate his smoker's index and assess the risks, it really makes him stop and think. I also show them their numbers from last year, weight, blood pressure, cholesterol, blood sugar, and then compare those with this year's results. That way they can see for themselves whether they're improving or slipping, still in the early pre-illness stage. That's when people start to take it seriously.
But even more powerful is the example set by some patients themselves. Flora Smailova remembers how one of her older patients surprised her.
Наклонился и достал носочки своими руками. Не каждый человек в 78 лет...
He bent down and took off his own socks. Not many people can do that at 78. The last time he came in, he said, "I even stand on my head." I told him no need for that anymore. He replied, "Just for 2 or 3 minutes, then I come down." This is someone who really knows how to take care of himself and stay in shape. Young people, if they don't feel pain, usually don't think about their health. They have other priorities, other concerns. But when someone gets sick and can't do the things they used to, that's when they start to think about their health. That's why I believe we should teach kids and young people early on to take their health seriously.
The dedication, skill and compassion of these doctors are recognized well beyond Kazakhstan. Every year, around 6,000 international patients come to the National Center for Treatment.
This is the somatic department at the National Hospital with 20 beds. It was established over 20 years ago and operates on a commercial basis. Our rooms offer a higher level of comfort. We have patients from Germany and France who are accustomed to certain standards and traditions, and they appreciate that this is a fully equipped multifunctional hospital. We provide nearly all types of exams and treatments, including surgeries like cardiac and oncology operations. We also offer personalized diet plans. The grounds are very pleasant, plenty of space to walk and many trees. You could call it a little green square right in the heart of the city.
Гулять можно, много деревьев, такой маленький золотой квадрат, скажем так, в центре города.
The National Hospital has earned international JCI accreditation 4 times, along with national accreditation from the Ministry of Health. This marks the high standard in medical care. The hospital continues to push forward, focusing on technology and innovation to consistently deliver top-quality care to its patients.